Hello everyone, today we're going to talk about fluoride and fluorosis and other related dental stuff that has to do with fluoride. Stay tuned and in this video.
Alright, before we start my video, I'm just going to let you know that fluoride is loved by the dentists because it's an inorganic compound that contains particles that remineralize the dental structure and prevents against decay. So that's one of the important stuff about fluoride.
So today we're going to talk about fluoride and what is basically fluoride. What is fluoride? What do you know about fluoride? I know that everyone hears fluoride a lot in toothpaste ads and in like some water bottle leaflet or something like that. But fluoride is actually an ion. It's available in many things you ingest around: water, chewing gum, toothpaste, mouthwash, and other stuff as well. So what we know about fluoride is that fluoride, let's say this is a fluoride ion, okay? A group of fluoride ions here, and that's your tooth. Anyhow, these fluoride ions get into the dental surface, so it mineralizes the tooth. So when too much of that gets inside the dental surface, something you have to know about the dental surface, like the surface of your tooth, whatever you want to draw it, it's porous, it's like skin, it has tiny little pores that can receive and send ions and other stuff through the tooth from inside to outside and vice versa. So how do teeth get affected? Well, it gets into the tooth via these pores, and if a lot of it comes, you will have something called fluorosis. Fluorosis is the excessive amount of fluoride ingested into the human body. What fluorosis can do, it can stain your teeth. There is of course three types of severity stages. There's light, medium, and heavy or severe staining. It can be from a simple white stain into a whole mouthful of brown spots and white mottled kind of spots. And if you want to know about the treatment plan, well, the treatment is dependent upon the severity of the the fluorosis. If you have light fluorosis, you can have a treatment of it by, let's say, bleaching, whitening, or peroxide gels, bleaching trays. But if it's moderate or severe, most useful treatment modality would be crowns or veneers. So that's more about fluoride, and some precautionary steps to avoid getting dental fluorosis is by monitoring your child, sibling, or whoever you see ingesting a lot of, let's say, mouthwash. Don't let your child ingest mouthwash or toothpaste because, you know, these children like the taste of toothpaste.
Guys, let me add extra to this video. Just don't let your child use mouthwash from 0 to 8 years old because he does not actually need that much of fluoride. Or what he can use is a tiny little amount of toothpaste on his toothbrush from, I think, years 2.5, 3 to around 8, and then he can start using extra preventive substances like mouthwash.
So just monitor that, and you'll make sure after their root development and crown development they will not get any signs of fluorosis. Thank you very much for watching. Until next video.